So, the next position for mobility of the chest, activation and facilitation of oblique abdominal muscles, opening the intercostal spaces, is Bharadvajasana on the chair. So, step in the chair. Ideally, if you have a chair like this. After, I will show you an option if you have a different type of chair. But if you have an option of you have a chair like this is ideal. So again, the legs are in abduction to have a space for abdominal wall. The shins are in vertical position, both of them, and the foot is active. Doesn't mean if you sit on the chair that the legs are not working at all. They are still supporting the whole body. We try to keep spine as much uprighted as possible, which we can create from the support. And again, create a length in abdominal wall, which means being a little bit taller. And then you will rotate the chest towards the right first. You can hold on the back of the chair and you can hold on the seat of the chair. First, what I would like to have is fully uprighted spine. So again, here is a little bit anterior tilt. So can you a little bit tilt the pelvis back? Upright from the thoracic spine. Roll the shoulders back. Move the scapulas down along the chest. Very good. You inhale to the sides of the chest and then you exhale and you gently twist. You pull the body towards the left arm and you move the body to the right. So the left arm is pulling, the right arm is more pushing. Inhale and exhale. The inhalation should increase the length, create a traction on the spine, open the intercostal spaces. The exhalation should allow the body to go gently deeper to the twist. Excellent.